Hello, everybody, and welcome to Dementia at Home. My name is Rebecca Porter, and I am one of the first-link supports for the Alzheimer's Society of New Brunswick. Today's educational video is all about assisting a person with dementia with dressing, toileting, and incontinence. We're going to start with dressing. The way we dress is a part of who we are, so the act of dressing is a highly personal activity. It's also one we're used to doing ourselves, along with making decisions about what to wear. When a person with dementia has difficulty getting dressed, it's important to allow him to make his own decisions for as long as possible and to carry out the activity as independently as possible. Reasons for difficulty dressing. They may have physical difficulties, for example, stiffness in her fingers or problems with her balance. He may have memory problems that make it confusing to remember how to get dressed, such as what to put on first. Depression may make her lose interest in getting dressed and looking after her appearance. She could also be confused about what you want her to do, distracted by noise, or too cold or warm to change clothes. He may also feel self-conscious about dressing in front of someone. Do what you can to create privacy, for example, closing the door or leaving him alone for a few minutes after setting up the clothing. Tips for making dressing easier. Whenever possible, allow her to choose the clothing to be worn that day. Limit the number of choices to make the decision easier. Lay out the clothing in the order that it needs to be put on. Remove extra clothing from the closet. Seeing a lot of clothing can be confusing. If he insists on wearing the same clothes every day, try to launder these clothes often. On the outside of dresser drawers, place labels or pictures from magazines to describe the contents. For some people, it may be helpful to group items of the same color or ones that are worn together. Hang ties, belts, or other accessories on the hanger with a matching shirt, dress, or pants. If she makes a mistake, be tactful in pointing it out, or find a way that you can both see the humor in it. Try not to worry when she dresses in unusual combinations of clothing. It may not be worth risking a confrontation, and she may be more content having made her own decision. In the long run, you want her to feel good about the way she looks and take pride in her appearance. Dressing can take a long time, particularly if he is doing much of it himself. Set aside enough time so that they don't feel rushed. Comfort and ease of dressing. Choose clothing that is easy to wear and care for. Zippers and Velcro are easier to fasten than buttons. Skirts and pants with elastic bands are easier to put on. Soft, stretchy materials are often the most comfortable and shouldn't be too tight. For a woman, a front-closing bra may be easier to put on herself. For men, boxer shorts may be easier to manage than fitted underwear. Slippers are comfortable, though they may not offer enough support to be worn all the time. Shopping for clothes. If possible, involve the person with dementia in shopping for clothes. If you do the shopping, check his size regularly, as he may have lost or gained weight. Choose clothing that is comfortable, easy to put on, and easy to wash. Remember that she may need to wear new clothes often before they become familiar to her, and she may think any new clothing doesn't belong to her. Buy several of the same favorite outfits so she believes she's wearing the same familiar clothes. Getting undressed. People with Alzheimer's disease may not understand why they're being expected to undress and may be reluctant to do so. Make sure to find a way to get him to change his clothes frequently so that they can be washed. A good opportunity to give him new clothes to put on is when he is bathing. Toileting and incontinence. Dementia can affect many aspects of a person's daily routine, including control over urination or defecation, incontinence. For a lot of us, this can be a touchy or awkward subject because it can be difficult to accept help in this intimate area of our lives, particularly from someone we're close to. Tips for reducing accidents. In some situations, bowel or bladder control issues may be preventable. If toileting becomes a challenge, try the following to help with your specific situation. Is urine being released with the pressure of a sneeze, cough, or laugh? Is the person taking medication that may be causing them to go to the bathroom often, such as a diuretic? Make an appointment to get a full medical assessment to rule out treatable medical issues and review medications. It could be a bladder infection, constipation, loss of bladder tone, weakening of control muscles, decreased bladder capacity, or for men, prostate problems. Can the person communicate that they need to go? Watch for cues that the person needs to use the washroom. For example, they may get restless, make unusual sounds or faces, or pace around the room. Do they understand the body's message that it's time to go? Give the person reminders to go to the toilet regularly, about every 2 hours or before going out. Can the person find the bathroom? Are other objects being mistaken for a toilet? Is the person more confused at night? Make the toilet easy to find. Mark the path on walls and/or floors. Make sure there are no obstacles, and label bathroom doors with words or pictures of a toilet. Use a contrasting colored toilet seat, colored tape around the toilet, or colored water. It may help prevent accidental misses due to the loss of perception or vision. For men, try putting a decal inside the toilet to have something to aim at. Put lids on waste paper baskets and other containers that could be mistaken for toilets. Remove door locks if the person isn't able to unlock the door without help. Make sure there is good lighting and night lights in the bedroom and hallways. Change the environment in any way that helps. Is it difficult for the person to get up from their bed or chair? If so, install handrails beside the toilet, bed, or chair, and install a raised toilet seat to make sitting down and getting up easier. Are they able to get undressed in time? Choose easy to remove clothing such as Velcro, closings, or elastic waists. Is going to the toilet too complicated? Is the person able to go through all the steps? For example, finding the toilet or undressing. Direct the individual to the front of the toilet before removing clothes. Give a cue to get started, such as running water, prompting, or showing them what to do. Hand the person toilet paper. You may need to help get the person started. Using wipes can be easier than toilet paper if you need to wipe for them. Give the person some privacy, but stay nearby. Explain to them that you are just outside the door if anything is needed. Make sure there is no medication or dangerous objects the person could have access to. If staying seated is a problem, play music or have a favorite item on hand like a book or a magazine. Use a commode toilet or a urinal in the bathroom. And if accidents happen during the night, consider getting a bedside commode toilet. Dealing with accidents. Accidents happen. Stay calm and try to ease any embarrassment the person might be feeling. Keep the person dry and clean. If accidents continue, disposable underwear, panty liners, or protective bedding may be helpful. Use them only if necessary and continue to take the person to the bathroom regularly. If you or someone you know are in need of more resources and support, please contact your local Alzheimer's Society at 1-800-664-8411. This has been Dementia at Home. Take care and be well.